Groups Against Gangs, Groups Against Gangs, Lauren Restrepo, Emma Sherwood, Amber Nebius, and Hannah Rothenberg. Mission statement. Our mission is to make our clients feel safe and heard within our agency, and to spread awareness and prevention strategies for community juvenile gang violence. We aim to reduce the amount of youth within our communities who enlist in gangs and other delinquent activities. The reduction of juvenile gang activity is heavily respondent upon communities, teachers, families, and educating role models on the proper way to address delinquent juvenile behavior. Mission statement. The youth.gov website mentions the most important mitigating factors for reducing youth gang activity as addressing elevated risk factors for joining a gang, strengthening families, improving community level supervision of youth, providing training for teachers on how to manage disruptive students, providing training for parents of disruptive and delinquent youth, reviewing and softening school zero tolerance policies to reduce suspensions and expulsions, providing tutoring for students who are performing poorly in school, increasing adult supervision of students after school, interpersonal skills training to students to help resolve conflicts, providing a center for youth recreation and referrals for services, providing gang awareness training for school personnel, parents, and students, and providing training for school resource officers in mediating conflicts. Value statement. Our agency aims to give at-risk youth a better future and the chance to strive for the life they deserve. We emphasize the importance of strong familial bonds and community efforts in protecting and caring for at-risk youth. Groups Against Gangs understands the outside factors that affect situations varying across different life circumstances and works continuously towards reduction of risk-inducing factors involved in developing at-risk youth. Vision statement. We hope to offer opportunities to our at-risk youth by giving them the tools they need to excel in their everyday lives. Groups Against Gangs gives persistent effort to educate and counsel at-risk youth on conflict resolution and stress management. Our agency envisions a world where access to respectful care, engagement, and counseling are accessible to all members within our community. We offer a positive therapeutic environment in which clients can learn positive coping mechanisms, navigate through current stressors, and heal from past traumas. Juvenile statistics. Our population are juveniles and youth in active gangs or at-risk youth. At-risk youth benefit from positive role models, support, school programs, after-school activities, tutoring, legal help, and counseling or guidance. Georgia's at-risk youth juvenile population has steadily increased over the past 15 years, estimated to be 2.4 million. This is a 43% increase in the number of at-risk youth since 1990.
Groups Against Gangs has 4 different delivery styles. The 4 styles are outpatient counseling, group counseling, family counseling, and school counseling. For outpatient counseling, clients have specialized treatment just for them specifically. This allows a one-on-one type setting with our counselors. For group counseling, this is a setting that allows peers to come together and share their stories. This way, clients can relate to one another, talk about similarities, differences, and how they have overcome their struggles. For family counseling, this can be for a family as a whole or for the parents with kids struggling or victims of juvenile gang violence. For school counseling, we allow students to be paired with others for tutoring. We allow counselors to come into classrooms and discuss with kids any struggles they might be having. And with that, we also provide school assemblies to promote our agency and make sure that kids are aware of the sources they have. Groups Against Gangs allows additional services within our facility. We have tutoring that we can pair young students with high school students in order for them to get help in school when they're struggling. For school programs and assembly days, we have counselors come in to different schools in the community and lead assemblies throughout the day to promote our agency as well as educate students on the struggles of being involved or being a victim of gang violence. For medical and psychiatric care, we have staff on site at our agency, such as psychiatrists to prescribe medicine and nurses to provide medical care on site. For legal and case management, we do have caseworkers on site as well who can be paired with a victim in order to provide them the best services and care they need. Groups Against Gangs values cultural competency within our counselors, diversity within both our counselors and our clients, and specialized treatment plans for our clients. In having specialized treatment plans for our clients, this gives a specific treatment for the needs of the client. So not one single client has the same treatment. We want our counselors to be cultural competent in every culture that comes their way. We want them to feel like they can understand the client and give them the most effective help. Groups Against Gangs strives to eliminate discrimination, educate and promote our services, bring peers together, and promote a safe space for our clients. In doing so, we allow our clients to feel comfortable within our agency as well as with the peers around them. In group settings, this brings peers together to share their stories and relate to each other. Legality fix for Groups Against Gangs. Our organization will be a nonprofit based in the state of Georgia. We chose to be a nonprofit due to wanting autonomy over all decisions and financials within our agency. We want to also make sure that in our agency, everyone understands and goes through compliance training of HIPAA and high tech. The legality of working with minors means we need to receive consent from either case managers, family members, or legal guardians over any medical or psychiatric health decisions and records. Within the Code of Ethics, we want to focus on Section A of informed consent in counseling relationships with all staff members. With that, each staff on hire will be going through training sessions with modules speaking over their relationship with our clients. In Section B, with confidentiality and privacy, we want to make sure our staff understands the importance of keeping everything confidential from names, records, and any other additional information over our clients. Required credentials within Groups Against Gangs. The onboard training will include ethics, confidentiality, crisis and trauma, HIPAA compliance, and basic understanding of what the day-to-day will be like within our agency. Some of the required degrees and credentials for all hiring staff must either fall under a bachelor's, LPC,
case managers, psychiatric nurses, social workers, those who are certified with or without a bachelor's degree in substance abuse, as well as teachers with certified teaching license, attorneys for our legal team, and all staff must have current CPR, AED, and first aid training. Required training for all employees. Crisis prevention intervention will be required for all employees, old or new, to help give a basic understanding of what will happen in any crisis. Each employee will go under code training that will be used for emergencies that will have specific response teams. For code blues, they'll be for agitated patients, tech needs assistance, or psychiatric emergency. Code green will be for weather emergencies that need a take cover and seek shelter. Code black will be used for active shooters. Code red will be for actively bleeding, hurt, immediate 911, or in need of hospital transportation. And finally, code purple will be for eloping or escaping patients. Additionally, module training will be required every 9 months for all employees, additionally as yearly evaluations. Patient payment. We will make sure that within our agency, we will accept most private insurances that are given through employers. Additionally, we will offer sliding scales for those patients who do not have insurance. With this option, they will either have a single fee payment depending on the patient's family financials, or we will offer payment fee based on the annual poverty line in the United States. Additional patient payment options. Our agency will offer discounted plans for those who have been with us after a year and a half. But after that allotted time, there must be proven progress with either notes from doctors or tutors with academic improvement. Patients will receive a discounted price. We will also offer payment plans based on what patients can pay through financial records. And our final option will be for those who wish to pay out of pocket.
Our agency will use CPT codes that can provide reimbursement to patients through insurance. CPT codes are for various medical services and can be reported to both private and public health insurance. These codes, as I said, are provided to insurance, which then allow clients to be reimbursed. We also used Anthem Blue Cross Blue Shield as an example of how to be credentialed to use certain insurances. So first you have to provide credentials through a data portal and then authorize Anthem to access this credentialing information. Once that has happened, providers must fill out the application to secure insurance credentialing and then finally get the approval. Our agency wants to collaborate with several organizations for the betterment and improvement of at-risk youth in the community. Groups Against Gangs is dedicated to collaborating with the education system, community and neighborhood boards, and the Department of Justice. These organizations are beneficial to helping us live out our mission statement. We want to partner with school districts in the state of Georgia, specifically Atlanta and Gwinnett County.
An idea we have is to provide after-school programs and offer youth the opportunity to participate in volunteer activities. We plan to educate teachers on how to handle at-risk students and involve them in our initiative to tutor juveniles who need extra academic support. Community members and neighborhood boards can take an active role in making sure these individuals feel supported and uplifted within the community. Our plan is to partner with communities and hold events to educate the public about at-risk youth in order for them to understand and learn about what they can do to help and contribute to the betterment of juveniles. This will allow juveniles to make connections and meet people that can serve as mentors to them. 3 specific organizations we have in mind to partner with are Project Safe Neighborhoods, National Gang Center, and Gang Resistance Education and Training Program. Project Safe Neighborhoods partners with both school districts as well as law enforcement to reduce violent crime, as well as keep neighborhoods safe in general. National Gang Center has a goal to prevent and reduce crime with the assistance of federal, state, and local justice systems throughout the nation. Gang Resistance Education and Training Program is specifically a program that is all about gang and violence prevention that also partners with school and law enforcement. So as you can see, we really want to engage the community and also engage law enforcement and schools to educate them about this topic and help to contribute in the betterment of these at-risk youth. There are 2 other agencies that we would want to collaborate with for the purpose of spreading awareness about at-risk youth. One is the Department of Corrections. Specifically, we would like to partner with them for the purposes of advocating and providing resources to juveniles in the justice system. We feel that it is our responsibility to not only try to prevent gangs and violence, but also to help those who are a part of the justice system to help them become reintegrated into the community faster. We also want to be a source to be able to advocate and teach at-risk youth how to advocate for themselves as well. And then local and public officials within the community, we would like to host events with and also educate officials in the community. And this includes policymakers so that they are more aware of the specific circumstances that youth in gangs and at-risk youth who have gotten themselves into gangs or violence, what they face, and what local and public officials can do to help them and to make their situation better.